Planned and unplanned caesarean birth. In the UK, about 30% of pregnant women and people will experience a caesarean birth. This means the surgical birth of your baby through a cut in your abdomen and womb. Around 50% of these will be planned. We call this an elective caesarean birth. The reasons to plan a caesarean birth are varied and can include maternal choice, previous caesarean births or surgery to your womb, your baby being in a breech or transverse position, a multiple birth if your leading twin is not head down, or if there are concerns about where your placenta is situated. Concerns for the health of either you or your baby. Some are unplanned. This is sometimes known as an emergency caesarean birth. This might occur if labour is not progressing and all other options have been explored, or if there are concerns for you or your baby's well-being. Although a caesarean birth may not be what you were hoping or planning for, it can be a positive birth experience. What to expect? A caesarean birth happens in theatre, and you will notice lots of equipment and a lot of staff. They will all introduce themselves to you and provide plenty of reassurance. Your midwife will stay with you, and you can expect to see 2 doctors, an anaesthetist, a theatre nurse, a neonatologist, and theatre assistants. They are an expert team and will take great care of you, your partner, and baby. There will be an intravenous drip in the back of your hand to keep you hydrated and to give any medications needed. You will also have a catheter, a small tube into your bladder. This keeps your bladder empty for surgery. Once surgery has begun, the birth of your baby is quite quick, about 10 minutes. In most instances, the baby is placed skin to skin with you or your partner while you wait for the operation to finish. Anaesthetic. The anaesthetist will be with you for the duration of your birth, monitoring and ensuring you are pain-free and comfortable. The aim is to use an epidural or spinal anaesthetic so you can stay awake to meet your baby and your partner can be with you. A general anaesthetic may be needed for some emergencies if there are medical reasons why a regional anaesthetic isn't suitable for you, or if you prefer to be asleep. Your choices for a caesarean birth. When planning a caesarean birth, we can discuss your birth wishes and preferences. It is worth discussing these during your pregnancy whilst completing your personalised care and support plan. A gentle caesarean birth. Consider ways to personalise your birth as you welcome your baby. This could include things like your choice of music playing, lowering the drapes so that you can see the birth of your baby, asking your partner to reveal the sex of your baby, delayed cord clamping, asking your partner to cut the cord, skin-to-skin contact with you. Birth partner role. In most circumstances, your birthing partner will be able to accompany you to theatre for the birth. They will need to change their clothes and wear theatre scrubs, and will usually be given theatre shoes or shoe covers and a hat. They will be sitting next to you so you can experience your baby's birth together. The only time your birth partner would not be able to be there is if you need a general anaesthetic, where you are put to sleep for the surgery. In this situation, they would remain on the labour ward being supported by the staff. Immediately after birth. Around 30 to 40 minutes after the birth of your baby, you will be transferred to the ward to recover for regular observations in the first few hours. Timings are different for everyone, but you will be encouraged to begin mobilising as soon as possible. When you are able to move around, your catheter will be removed. You'll be offered water initially, followed by some food. When you're able to drink fluids, your drip will be stopped. If it's no longer needed for fluids or medications, the intravenous access can then be removed. Early days. If your caesarean birth was straightforward, you can expect to go home between 24 and 48 hours later. Before you leave, you will be given advice on how to care for your wound and stitches, when you can remove the dressing, and activities you should avoid whilst you recover. You will be sent home with medication to control any pain or discomfort. It's important to keep yourself as comfortable as possible so you can rest and recover. This will include wearing loose, comfortable clothing and underwear. Any medication that you are given will be safe to use if you have chosen to breastfeed your baby. Your community midwife will visit regularly to ensure you are recovering well. You may need extra support whilst you recover, especially if you have other small children to care for. You should only resume driving, carrying heavy items, and formal exercise when you are fully recovered. This may take up to 6 weeks. What does this mean for future pregnancies and births? You're at a slightly increased risk of your placenta embedding into the scar tissue from before. This risk increases with the more caesarean births you have. 75% of those who have had one caesarean will go on to have a vaginal birth in their next pregnancy. If you have given birth vaginally before your first caesarean, this increases to 90%. Now that there's a scar on your womb, there's a 0.5% chance that this can separate or tear in a subsequent labour. This is less likely if you go into spontaneous labour than if you are induced. Experiencing a caesarean birth, whether planned or unplanned, may seem like a medical procedure where choice is limited. The maternity team will work in partnership with you to make your birth experience as personalised as possible. If this situation arises during pregnancy, please speak with your midwife about what is important to you. To find out more, visit sneewellbeing.org.uk/maternity.